Welcome to the Friday Checkup with Dr. J. I'm Dr. Julie, and let's get into it. Today's topic, motherhood. How many of us are truly prepared for the moment they hand you this little baby and say, "Here you go, you're responsible for the rest of your life"? I'm going to say not many of us. No matter how prepared we think we are, it is an overwhelming sensation to realize you are responsible for this little baby for the rest of your life. But fear not, I'm here to tell you that millions of women have done this thing called motherhood with great success, and that we're going to get through this together. You are not alone. If you are feeling stressed, overwhelmed, or feeling like an inadequate parent, I'm hopefully here to convince you that you're fine. The baby's going to be fine. As long as you tend to the baby's basic needs, everything's going to turn out okay. I tell parents in the office all the time that they need to have the full parenting experience. If their first baby is wonderful and easy and so perfect, that the second one's going to be a terror, and that not everything is the same for each baby. So, those of us like me, who was very cocky during my first pregnancy, I was like, I'm a teacher, a pediatrician, a seasoned babysitter. I've taken care of kids my whole life. This is going to be a piece of cake. No, 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 no. God has a very funny sense of humor. He sends me one of the worst babies on the planet. Colic, reflux, didn't want to sleep, didn't want to eat, hated her car seat, just wanted to be held, cried all day long. It was very, very overwhelming, very stressful. My body was a hormonal mess. I was overwhelmed. I was feeling inadequate. I had to alter my parenting beliefs. I had to change some of my techniques that I had sworn by. I actually did things that I tell parents in the office absolutely not to do, but hey, desperate times call for desperate measures. So, again, I'm here to tell you we're all human. Every baby is different. Even children in the same family are different. So, we need to learn techniques and such to deal with our individual child. So I get a lot of questions in the office these first few weeks of life. So I kind of want to hit on some of those topics today. One of the topics is bonding. Is it normal to not feel an immediate attachment and bonding with your child? Yes. Do some women immediately bond with their child? Absolutely. But if you're feeling like, I don't know, I'm doing instinctually what I should be doing, but I'm not really sure if this is right, it's okay. The most important thing is feed your baby, take care of their basic needs, and take care of your mental health. When your hormones are going crazy, you haven't slept, you're getting advice from in laws and your perfect sister in law and the lady behind you at the grocery store, everyone's telling you what to do. You don't need to listen to them. You need to listen to your gut and do what you feel is right, taking care of your baby. But I'm here to tell you if you don't have that instant attachment, it's okay, but it is important to bond with your child. And over time, if you feel that it's not working, if you truly feel like you're having some emotional postpartum depression, whatever, please go speak to your doctor, speak to either your OBGYN, your pediatrician, your psychologist, whoever. There is help out there. Speak to a girlfriend. We moms need to be mentally sound to take care of our children because, like I said, it is the hardest job in the world, very stressful, emotionally challenging, but an instant bond with your baby, if that didn't happen, it's okay. It will happen over time. So just keep trying and reach out for help if you need it. One of the second things that parents always worry about is feeding. Am I a horrible, terrible mom if I don't breastfeed? No, no, you're not. What about if I'm trying and it's not working? Is it okay if I give them formula? 100% yes. At the end of the day, you absolutely just need to feed your baby. Breastfeeding is best. That is what we recommend. However, some of us are not good breastfeeders. That some of babies are not good breastfeeders, and it's okay. Keep trying. If you breastfeed for 1 minute, if you're 1 day, 1 week, 1 year, whatever you do is wonderful and great, and your baby's going to get benefits from that. But if you can't, do not beat yourself up over it. Please go get some wonderful formula. There's great formulas out there. I'm kind of old fashioned. I like the old tried and true. There's all these new fancy organic and expensive stuff that all these, perfect bloggers with their perfect families promote. I'm not going to promote any specific product, but the tried and true we do recommend. And again, talk to your physician. If you're our patient, come in, talk to Dr. B and I. We'll be happy to walk you through that. But please, please do not feel guilty if you cannot breastfeed. If there's like a technical issue, there are lactation consultants and there's resources, and reach out to your physician or to us, and we will guide you in that right direction. Some of the other questions that I get a lot are pooping. I do not understand why everyone in the world is so concerned with babies' poops. It's like the grandma's talking about it, the moms, the babysitter, the nanny. everyone is concerned with this little tiny baby's poops. So, in general, they should poop every day, but that's not necessarily the case. Hopefully, Dr. B will go over some details about constipation. He'll probably put up a lecture about that with all the medical stuff. But for our purposes, if the child hasn't pooped in 3 to 5 days, you probably want to call your provider. Um, and in general, if the baby is eating, not vomiting, their belly is soft, not distended, they're passing gas, you're okay. They don't have to poop every single day. But 3 to 5 days is our general rule. And again, we can talk about that in detail if you're our patient. Talk to your provider if you have any questions. But no need to freak out if the baby's, had a day without pooping. And if they're gassy, there's gas drops. You can definitely use those. We do recommend probiotics. That is also healthy. So you can certainly try one of those, but let's not freak out with the pooping issue. The other big concern is sleeping. My newborn's sleeping. They're either sleeping too much, they're sleeping too little. How do we know what's good? I wouldn't brag if my newborn slept all through the night. They do need to get up and eat every few hours. That's how they're going to grow. That's how their brain's going to develop. So we want to encourage sleeping like during the day, about 2 hours, wake them up, feed them. At night, they can go about 4 hours. And again, I'm sure Dr. Bassett's going to hit this with one of his lectures. There is a great lecture on, I know, newborn rashes, which we'll come to. But again, don't be so concerned with the sleeping pattern, the sleeping habit. They just need to sleep for a few hours during the day, wake them up, feed them a few hours at night. They probably will not sleep all through the night until they're several months old. And again, we can talk about that on another day, but do not expect that your newborn is going to sleep for 8 hours. We don't want that. We want them eating about every 4 hours. One of the other topics is rashes. That's a big one. Babies come out, they look like they're going through puberty. They can have all these little pimply like things on them. They can have birthmarks, all kinds of stuff. And Dr. B has actually done a really excellent lecture series on newborn skin rashes, complete with pictures and explanations. So if you have concerns with that, please do check out his website or podcast, and he can get you up to speed on all those rashes. But again, especially breastfeeding moms, rashes are going to be normal. Just like kind of going through puberty, you're going to get that baby acne. It's totally normal, not much to do, but check out Dr. B's podcast on that. The last thing is some noisy breathing. I get a million phone calls. I'm like, why does my kid sound like a little animal? And also, why do they keep having hiccups? Well, it's normal. Most of the time, it's normal. Kids have very small airways. They have congestion. They cannot clear their throat. They can't blow their nose on demand. So the when they're sleeping is okay. When you have your monitors on, I know it freaks all the new moms out because it's not quiet. You hear constant noise. And the hiccups, that again is normal. There's really not much to do for the hiccups. Some of them had them in utero. You probably felt them when you were pregnant, and that can carry out into the first few weeks of life. So nothing alarming with that. So hopefully I just hit on a few of the highlights of newborn moms and their concerns. I mean, we could spend all day. There's not enough time in the day to talk about motherhood. And I would love to sit and chat with you all longer, but you're busy moms. You don't have a lot of free time. So you need to get back to taking care of your kids. I'll come back next week. And if you want to comment and send me some topics or questions, I'll be happy to try to address that. Maybe we can do specific question and answer. If you are our patient and you want to talk about something, just send me a text or call me at the office. But until next time, I'm Dr. J. Check me out next Friday, and please go check out The Buzz with Dr. B. Thanks. See you next week.